Excellent topic, Dr. Sina. Here's a high-yield USMLE-style clinical vignette focused on ovarian torsion, which involves twisting of the ovary and fallopian tube, compromising venous and lymphatic flow first, followed by arterial obstruction and necrosis. USMLE-style question, ovarian torsion. Clinical vignette. A 25-year-old woman presents to the emergency department with sudden onset of severe right lower abdominal pain. She describes it as sharp and constant, and it started 3 hours ago. She also has nausea, but no vomiting or fever. Her last menstrual period was 2 weeks ago and regular. Physical exam shows right lower quadrant tenderness without rebound or guarding. Pelvic ultrasound reveals an enlarged right ovary with reduced blood flow on Doppler imaging. Which of the following best explains the pathophysiology of this patient's condition? A. Implantation of ectopic pregnancy into the fallopian tube wall. B. Rupture of a follicular cyst with hemoperitoneum. C. Twisting of ovarian vessels leading to obstruction of venous and lymphatic drainage. D. Infection of the fallopian tubes resulting in tubo-ovarian abscess. Correct answer, C. Twisting of ovarian vessels leading to obstruction of venous and lymphatic drainage. Explanation: this patient presents with classic signs of ovarian torsion: sudden, unilateral lower abdominal pain, nausea, and an enlarged ovary on imaging with reduced blood flow. Ovarian torsion results from twisting of the ovary and sometimes the fallopian tube, usually around the infundibulopelvic ligament, suspensory ligament of the ovary, which contains the ovarian vessels. Initial blockage of venous and lymphatic return, leading to edema. Arterial flow may persist early, but as edema increases, arterial obstruction, ischemia, and necrosis. Why not the others? A. Ectopic pregnancy presents with vaginal bleeding and positive HCG. B. Ruptured cyst is sudden pain but not associated with torsion or decreased blood flow. D. Tubo-ovarian abscess is gradual onset with fever and signs of infection. Summary: ovarian torsion cause twisting around infundibulopelvic ligament. First affected, venous and lymphatic outflow. Later affected, arterial inflow, ischemia. Risk factors: ovarian mass cyst, pregnancy, hypermobility. Key symptoms: sudden unilateral pain, best test, pelvic US with Doppler, absent flow. Surgical detorsion emergency laparoscopy.